Recovery. Weaning from organ support. As the patient improves, the amount of organ support required can be reduced. For instance, when patients are ready to start breathing for themselves, their breathing support can gradually be reduced. This may involve the ventilator doing less work. Eventually, the breathing tube will be taken out. Sometimes a tracheostomy, which is normally a temporary tube that passes through the front of the throat, will need to be inserted instead of the usual ventilator tube that passes into the mouth. This will not be required for all patients. A tracheostomy can look quite worrying if you have not seen one before. Patients do adjust to this and often find it more comfortable than the previous breathing tube. As ventilatory support is reduced, a special valve can be placed on the end of the tracheostomy tube, enabling speech, so that the patient can communicate better with family and staff. Recovery after being in intensive care can often be a lengthy process. When patients have been so unwell and haven't been doing their usual activities for a period of time, they are likely to be much weaker than they were before. Although we want their recovery period to be smooth, patients are susceptible to setbacks or complications of their illness. This can be very difficult not just for the patients, but for families and loved ones too. Emotional and environmental support. Something that may concern families is the emotional and psychological impact of a stay in the intensive care unit. Unfortunately, when sedation is being withdrawn, patients may experience some confusion and occasionally hallucinations, but this should resolve over time. Memories from intensive care can vary from patient to patient. Some patients may remember very little or nothing at all, whilst others may recall things in more detail and potentially experience longer-lasting effects, such as low mood or poor sleep. Whatever patients face following their experience, there will be support from staff and other dedicated professionals. Rehabilitation. A number of different specialists help patients recover, including physiotherapists who help with breathing exercises, regaining muscle strength and walking. Patients may also have therapy for their speech and swallowing. Emotional support is an important part of getting patients back to their usual selves. We try to deliver personalised care where possible, and relatives can tell us more about their loved one to aid this process. When patients no longer need assistance with their breathing, they are moved onto another ward where they will continue to receive support from the ward teams. On discharge from the hospital, they may still be recovering at this stage, and it may take further therapy in the community and more time to return to their normal life. We hope you have found this video helpful. Please contact the team with any queries or if you need further information on ICU or for any additional support.